bladder carcinoma. This is called as urothelial urinary bladder carcinoma. There are three main varieties of this carcinoma. The most prevalent in ratio is urothelial, that is arising from the transitional cell, that is the inner lining of the urinary bladder. It is more prevalent in men as compared to females. The initial diagnosis and treatment brings better prognosis, but in this carcinoma, there are more chances of recurrence. So follow-on testing, diagnostic checkup is necessary for the treatment of this bladder carcinoma, because there is more tendency towards recurrence in this type of carcinoma. So there are main three types: urothelial carcinoma, squamous cell carcinoma, adenomatous carcinoma. But the most common is the urothelial or transitional cell carcinoma of the bladder. So these are three types. Now the grading of the bladder carcinoma. When the carcinoma is limited in the inner lining of the bladder, it is called as carcinoma in situ. In this, the cancerous transitional cells, they are limited in the inside the lumen of the bladder. Next is when the cells undergo rapid replication, they invade the basement membrane and invade the lamina propria. This is a second stage. Third stage is when the cancerous cells penetrate the muscular layer of the bladder. So this is the third stage. And they penetrate the muscular layer and comes outside the bladder, invading the surrounding lymph nodes and the other organs in the pelvic cavity. The final, which is very crucial one, is metastatic stage, in which the tumor cell shed off into pieces and they travel through lymphatic channel and bloodstream to the distant parts of the body, especially bone, liver, lung, brain. So this is the final stage, and it is a very critical one. In the initial primary stage, when the carcinoma is limited inside the bladder cavity, that is treatable, easily treatable, can be cured, but follow-on treatment on the checkup is necessary. The follow-on checkup and treatment is compulsory one. So these are the stages. In brief, we can divide the grading into two parts: non-muscular invasive cancer and invasive muscular cancer. So these are two varieties. When it is non-muscular, it is limited in the inside the bladder. When it is invasive muscular one, then it has penetrated all the layers of the bladder and it has attacked the pelvic organs and is going to produce metastasis to the distant organs. Now the symptoms of the bladder carcinoma. The main symptom is hematuria, blood in urine. The color of blood is coffee colored. Then there is dysuria, painful micturition. When the person is peeing, he feels difficulty, he or she feels difficulty. Then there is frequency of the urination, desire, and incontinence of urine, that is the weakness in the control of the micturition reflex. Next is there is loss of appetite, night sweats, depression, loss of weight. That is traditional symptoms of the general cancer in any part of the body. The main is hematuria, dysuria, frequency and incontinence of the peeing or the urination. These are the main symptoms in the patient one. Now the diagnosis of the cancer. Urine test routine and the analysis, culture sensitivity. If there is pathogenic invasion, that is infection, then we can perform the culture sensitivity to eradicate the infection. Then we can also detect albumin secretion, RBC, pus cells. These are all calculated by the microscopic examination of the urine specimen. Blood examination for electrolytes and especially creatinine and urea. So in this disease, the bladder carcinoma, creatinine and the urea level, they are usually raised. Next is the ultrasound examination, that is abdominal ultrasonography, pelvic sonography, detect the size, location of the tumor, and also the pelvic organ physiology, pathology, whether it is a limited one and whether it has invaded the pelvic other organs. So sound waves energy is used for detection of this test. Next is the electronic device that is called as cystoscopy. Cystoscope is a electronic device in which there is camera and also the vision light, and that is passed through the urethra into the bladder to visualize the inner surface of the bladder, especially the exact size, location, and also through this, by means of this device, we can also cut a piece of the tumor, which is called as biopsy, and is sent to the laboratory for histological study, and also to estimate the types and the grading of the cancer.